In the course of the last 10 years in private practice, I've come to specialize in breast augmentation and certain facets of surgery of the breast. Breast augmentation is a procedure that's been around for many years, but only has really been refined to a true science in perhaps the last 10 or 15 years. During that course of that time, there have been tremendous advances in both implants that we are able to use now and the procedures that we use to place the implants. There are several keys to performing the proper breast augmentation, and these have evolved through the years. I personally have an experience now with over 6,000 breast augmentations, and this experience has led me into the proper method of placing the breast implants while achieving the best possible results, the best possible symmetry, and the best, most natural looking results. There are a few basics about breast augmentation that every patient should know. The first is the type of implant. There are two basic types of implants, saline and silicone. Saline implants have been around from essentially the beginning. Silicone implants have had an evolution where they began as perhaps a less than ideal implant. Those implants had a thinner shell and had a bleed rate. In other words, the silicone would slowly leak. And these were the implants that were used primarily prior to 1991, at which point the government placed a moratorium on the implants. It should be stressed that in 1991, the reason silicone breast implants were taken off of the market was not because they were ever found to be unsafe, not because they were ever linked to any disease process, but because the FDA deemed that they should be studied more in depth. Multiple studies, including studies by the FDA themselves, have conclusively shown that silicone breast implants are not linked, nor do they cause any kind of autoimmune disease, or any disease for that matter. It is because of these studies that silicone implants have now been allowed to be used in the general population with some very minimal criteria. It should be noted that these silicone implants are a new generation of implants completely different from the ones that were used prior to 1991. These silicone implants have a thicker shell and have more a cohesive silicone. What that means is that these implants do not have a bleed rate. No silicone is leaking. And to make the matter even better for the patients, the silicone itself is more of a semi-solid rather than a semi-liquid. These implants can be cut in half, held upside down, squeezed, and the silicone itself will still maintain the shape. This has turned into a much safer, much better product for breast augmentation. The reason that silicone implants have made such a resurgence is because of the way they look and they feel. Quite simply, there's no substitute for a silicone breast implant as far as the best possible feel and the best possible look. I'd like to take a few moments now to talk about breast implants and the differences between them. I'd like to begin with talking about this implant. This is a saline breast implant. There are a few features about this implant that make it different from a silicone implant. The shell itself, however, is identical. The difference between this shell and the shell of a silicone implant is this valve right here. This is how the saline implant is filled once it's inside the body. When the implant comes packaged, it's empty, which makes it easier to place through a smaller incision. Once the implant is placed into either the subglandular or the submuscular pocket, which we'll hit upon later, a valve is placed into this area of the implant, and then the implant is filled with salt water. The advantages of a saline breast implant is that because it has a smaller incision that's required for its placement, there are more options for access. This can be placed through a transaxillary or an armpit incision, through an areolar or by the nipple incision, through a lower fold incision, or a transumbilical or a belly button incision. Some of these options fade away when you talk about a silicone breast implant. The great disadvantage of the saline implant is the saline itself. It is not a good mimic for breast tissue, and it doesn't lead to the best feeling result. Quite simply, these are not as natural an implant. When you touch a saline implant, you're able to feel the edge much more prominently than with a silicone implant. That translates into something called rippling or wrinkling. The risk